Suppose any child swallows a coin, then where it can stuck and where it is harmful. So I want, first of all, you tell us about your achievements of life.
Ji sir. So basically starting with, I have been a very adventurous person since childhood. I love adventure sports, and I have also been into bodybuilding. In 2023, I have won the Western Zone bodybuilding competition in the West Zone of Maharashtra, and I have stood fourth in that position. Also, according to the adventurous sports, I am also very good at academics. I have also published 5 papers in different national and international journals, which are spanning different subjects as well. Sir, I also have a fellowship in advanced gastroenterology, which has been done recently in February. Sir, as far as concerned, I'm one of the youngest surgeons who have done such a fellowship, and I think that I can, in future, also achieve many more golden achievements and have more feathers in my cap. So I would look forward in getting such a chance to prove myself.
Okay, now I want that since you are a surgeon, so how your higher education will be helpful to armed medical corps?
Sure thing, sir. Sir, as per what I have seen, that surgeons are the people who are the very first people on the scene of any emergency. As compared to emergency medicine and surgery, anything that is an emergency is first entertained or attained by surgery people. May it be any pain in abdomen, may it be any accident, may it be any disaster. Whoever is the first to attend that patient is the surgeon. And I think in such an institution, that is the armed medical corps, a surgeon will have a valid place and an important position. And hence, I think that my higher education would prove a brownie point in armed medical college, armed medical corps institution.
Okay, tell about road traffic accidents and the trauma situations. Yes.
Ji, sir. Road traffic accidents are basically disasters or accidents which occur on the roads, which can be between a pedestrian and a vehicle or between two vehicles. That can be one of it. Road traffic accidents can vary according to the trauma, as the trauma can be very trivial, which can be managed as per the triaging system into green, and the patient is given first aid and can be sent home. Secondly, accordingly, after we triage, there can be trauma associated to the head, it can be to the chest, it can be to the abdomen, it can be to the pelvis, and it can be to the neck as well. According to these systems, the patient has to be classified, and accordingly, the first aid has to be done, and accordingly, we have to give the primary treatment, stabilization, and then further go on for higher level of treatment protocols.
Management of head trauma.
Sure thing, sir. Sir, first of all, patient of head trauma comes to my particular casualty or my particular place, and whenever it is attained by me, first of all, the thing would be to check for the responsiveness of the patient. If the patient is responsive or if the patient is not responsive. Let us consider if the patient is responsive. I would first go on to ask the patient's orientation, whether the patient is oriented to time, person. If the patient is not oriented to time, place, and person, the first thing would be to attain 2 IV lines and start him on emergency, whether or not the patient is bleeding or not. As if the patient is bleeding, we can see visible bleeding. If the patient is not bleeding, we can consider internal bleeding that might be going on in his cranium or the head part. Then accordingly, the patient has to be shifted to CT scan first and checked for any internal bleeding in the brain. And accordingly, after the CT scan reports are available, we can go for the management. Before doing the CT scan, I would trying to measure the GCS of the patient, that is the Glasgow Coma Scale, and accordingly classify the patient into mild, moderate, and severe class.
Okay, tell something about Glasgow Coma Scale.
Yes, sir. So the Glasgow Coma Scale has basically 4 variants. That is the new version. The older one had 3 variants. The older one had the responsiveness of the eye. Second is the motor movements, and third is the vocal component. The eye movement has 4 points. That is that is spontaneous. Second would be to speech. Third would be to pain, and fourth will be no response. Similarly, will be for the vocal component, that gives a comprehensible and a well-oriented speech to time, place, and person. Then there would be inappropriate words, incomprehensible speech. Then there would be no response. Similarly, for the motor movements, it would be patient obeying to the commands, or it can be because it can be abnormal flexion, extension. It can be responsiveness to the pain, and accordingly, it is great. The minimum score that is given is 3, and the maximum score given is 15. Okay. And the fourth component which has been added on is the pupillary score, that is pupils react to light or no when both are constricting or both are being dilated, or whether one is constricted and other is dilated. And it is basically a telltale sign which can suggest on which side is the bleeding present. That is, on the dilated side is most commonly the part where bleeding has occurred because of the third cranial nerve.
Okay, tell us about gunshot.
Gunshot injury. Sure thing, sir. Sir, gunshot injury is basically an injury which is because of a projectile. The projectile is basically can be a sharp thing or it can be an added on thing. A gunshot injury basically has an entry wound and has an exit wound. If not, the projectile is inside the body itself. The entry wound is basically a smaller wound, and then the exit wound is basically a larger wound. Taking into consideration, if the gunshot wound is from a muzzled vehicle or if it has tethering within it, then it will have greater speed and a greater trauma effect and would cause a bursting effect along with burning effect on the entry wound as well as the internal organ. If it is because of a shotgun, it can be a multiple penetrating wound and it will have more trauma on impact and not to the internal vessels. On the impact point, that is the first point, we can see burning, charring, and inflammation along with erythema. Whereas on the internal organs, it can show perforation, bleeding, hematoma, injury to the organs, and in the part, if it has gone through and through, then we can see similar wound on the outer aspects. But we can differentiate from the exit wound in the format of the edges of the wound. If the edges are towards the inside, it is an entry wound, and if it is towards the outside, it is an exit.
Okay. I want to know something now, a new topic, bowel perforation.
Sure thing, sir. Sir, bowel perforation is a perforation that can be present anywhere from the stomach up till the intestine, that is the large intestine, up till the sigmoid colon. It is considered as a bowel perforation. Bowel perforation can occur due to multiple causes. It can be because of any ulcer. It can be because of any obstruction, which can cause necrosis of the bowel wall and then perforation. It can be due to any polyp. It can be due to a foreign object. It can be due to any intestinal helminthic infection, or it can be due to any foreign body. In such a particular case, whenever there is a bowel perforation, the patient will present with complaints of vomiting, along with pain in abdomen, along with reduced blood pressure and altered consciousness. Whenever such a patient comes, the first thing is stabilizing the blood pressure, that is the that is hypovolemia, which is given by normal saline or most probably hetastat, which is basically done to manage the intravascular volume. The diagnosis is basically done on the presence of erect abdominal X-ray, which can be seen in the form of air under diaphragm. Even an advanced check can be done by using a CT scan, whichever is better. But I would think that X-ray would be a better investigation because it is easier and has less radiation. Whenever such a patient comes and we have X-ray under air under diaphragm, in the X-ray, the first thing is to pose the patients for the operative treatment, because bowel perforation cannot be managed conservatively, and such perforation can be managed by either open laparotomy or by laparoscopic surgery, which can be done by me. Both can be done by.
Okay. Suppose any child swallows a coin, then where it can stuck and where it is harmful?
जी सर, अगर कोई बच्चा कॉइन निगल भी लेता है तो फर्स्ट ऑफ ऑल डिपेंडिंग अपॉन द एज ऑफ द चाइल्ड, एंड आई विल आस्क द पेशेंट्स, बच्चे के पेरेंट्स, कि which coin did the child has swallowed. It can be a smaller coin, then it is nothing to be done and it will pass off in the stools. If it is a bigger coin like a 10 rupee coin or 20 rupee coin, for further investigations, then we have to go for further investigations. If at all the coin is bigger, the first investigations I would like to do is an X-ray. The coin can be seen at the cricopharyngeal junction, that is the first junction. Later on, it can be seen at the hilar junction where the trachea bifurcates. And third, it can be obstructed at the cardiac angle of the esophagus and the stomach. These are the three places where the coins can get obstructed. If the coin does not get obstructed in the three parts, the coin will not get obstructed and will be passed in the stools eventually. Then at this point of time, we have to give bulk stool enhancers to the patient so that a lot of bulk stool is passed and lot of soft foods to be given so that stool quantity is formed and it can be pushed outwards.
Okay, speak on stab injury.
Sure thing, sir. Sure thing, sir. Stab injury is an injury in which it is basically a type of homicidal injury in which one person with an intent to kill another person injures the victim with a sharp and a pointed object. With a sharp and a pointed object. The stab injury can occur anywhere in the head, it can occur in the neck, it can occur in the chest, it can occur in the abdomen, and as well as it can occur in the pelvis. And such a wound has an entry point and can also have an exit point as well through and through. In such a condition, bowel can be injured, liver can be injured. The most common organ that is injured is the liver. If there is an abdomen, the chest, it is basically the lungs and the heart, and the great vessels can also be injured.
Suppose the stab is on epigastrium.
Okay, sir. If the stab is in the epigastric region, liver is one of the major organs that is injured. Then stomach is one of the major organs that is injured, and abdominal aorta is one of the major organs that can be injured. There would be perforation in the stomach. There can be hematoma or total ulcerations that can be seen, and there can be injury to the aorta, that is the descending aorta, and then can be huge hematoma into the abdomen. And such a condition is a very serious condition and it requires a high level of exploratory laparotomy, which has to be done in an open scenario and cannot be approached by laparoscopic surgery.
Okay, what is blast injury?
Sure, sir. So blast injury is basically an injury which occurs basically any explosive material. It is an injury basically which is caused by the compression and rarefaction of that is basically that occurs. In such a condition, the air in the surrounding gets compressed and eventually gets rarefied, and because of this difference in the pressure, there is injury to the organs. The major organs that can be injured in a blast injury is basically the organs which contain air, that is the intestines and the lungs, along with the tympanic membrane that can be injured, whereas the heart and the hard organs are least to be injured. Condition including the blast injuries, there can be penetrating injury or gunshot injuries as well because of the add-ons which can be put in explosives, and these have a different type of scenario which are different in every other case. There can be also be seen in the form blast injuries also have a form because of when the air pressure changes, it can basically push the victim to any hard object or to the building can cause tertiary level of injuries. Because of the air pressure, it is primary injuries. It can be because of the add-ons which are quaternary of injuries that can be seen in blast injury kind of patients.
Okay, I want you to speak on BPH.
Sure thing, sir. Sir, BPH is basically benign prostatic hyperplasia, which is basically seen in age-old patients. These are basically patients which are from 50 years to 90 years of age. It is basically the hypertrophy of the prostate, that is the median lobe, the lateral lobes of the prostate. This basically are the regions which are around the urethra. With age, as the testosterone level in men, there is an increase in dihydrotestosterone which rises. Because of this dihydrotestosterone levels, there is hypertrophy of this particular lobes, and because of this particular lobes, there is compression of the urethra, and such a condition causes inability to urinate, that is urinary incontinence. It can cause ineffective voiding, it can cause urge incontinence and other urinary symptoms that can be seen. It can also cause bleeding, which can be seen because of hemorrhoids or vesical plexus piles, we can say, that is vesical hemorrhoids can be seen in benign prostatic hyperplasia. The basic treatment for this particular thing is transurethral resection of prostate. It can also be reduced in some grade 1 prostatic hyperplasias with tamcortin or tamgrasd, that is alpha receptor blocking agents that can cause relief in some patients. However, TRP would be the best possible choice for any patient who is above 60 years of age.
Management of CA breast.
I would like to start with breast carcinoma
Management,
first.
if you want, yes, you want to say something.
I would like to start with breast carcinoma. Yes, sir.
Yes,
basically,
yes.
the patient, whoever comes with breast, should be proceeded with caution because there is a high incidence of breast carcinoma which is rising up since the last 4 to 5 years, and India has also started breast awareness campaign in all over India. That is a very nice initiative which is taken by the government. Basically, the consideration would be if there is a lump in the breast and intraoperatively we remove the lump, this particular lump can be sent for frozen section. And if the frozen section has a chance of being malignant at any point of time, or might be, we can consider if we do a sentinel node biopsy and after removing the sentinel node and we find out that the sentinel is positive or is carcinomatous, then we have to go for a complete mastectomy along with axillary dissection. And this particularly, if we have first considered of a mastectomy or a simple lumpectomy, and on frozen section, we find out that if the patient has a carcinomatous changes in that particular lump, or maybe the lymph node is positive, then we have to intraoperatively consult or tell the relatives that the patient has cancer, and we have to advance the operative treatment further on to a complete mastectomy with dissection.
Okay. Okay, now I want to know from you the role of medical officer.
Sure thing, sir. Sir, medical officer is basically a person who is given by the government to complete responsibilities like immunization, maternal and child health care, reproductive technologies, health, any communicable and non-communicable diseases, to continue the cold chain, to check out for the sub-centers and the secondary centers, then also to take care of the ASHA workers, the health workers, then also to check out for any school health campaigns for nutrition as well as anemia and all has to be done. Then secondly, for malaria, that is the communicable diseases, malaria, chikungunya, that is to be done. Then secondly, attend all the OPDs and OTs as a medical officer that you have to do, as well as attend the casualties, as well as the other specialty work that is assigned to that particular medical officer.
Okay, speak on acute abdomen.
Okay, sir. So acute abdomen is basically pain in abdomen that we can consider, in which the patient presents with severe pain and tenderness in abdomen, which is seen in the form of along with guarding and rigidity. This particular patient has totally rigid abdomen and does not allow the examiner to palpate. Such an abdomen has to be explored surgically, might be laparoscopically or surgically. It can be a perforation, it can be peritonitis, it can be an obstruction or any of that sort, and has to be managed as per their management protocols.
Okay, and speak on hernia.
Sure, thing, sir. Basically, hernia can be defined as abnormal protrusion of the viscus from a cavity which is containing it through a wall or a the wall that contains it. So the hernia can be multiple types. It can be diaphragmatic hernia, it can be epigastric hernia, it can be umbilical, paraumbilical hernia, it can be inguinal hernia, it can be rectal prolapse is also considered as hernia also. These are the types of hernia that are present. The hernia has to be managed surgically and other management protocol that is present. Right now for inguinal hernia, what we do is a Lichtenstein's modified mesh repair that is present. Nowadays, we can also do as a tap and a tap repair that is laparoscopically done, in which the mesh is placed just above the peritoneum by going either direct intra-abdominally or creating a space between the peritoneum and the abdominal wall where the mesh is placed and the hernial contents are reduced.
Wonderful. Speak on peptic ulcers.
Sure. So, ulcers are ulcers which are usually present in the stomach, that is the lower curvature of stomach, and the duodenum. This is basically due to hypertension. That can be because of patients with blood group B positive. It can be in people which consume more of chili. This can be in people which have more of stress disorder. This can be people which consume more of alcohol. In such particular patients, there is a hypersecretion of acid, and because of this acid and low level carbonates, the acid flows down along the lesser curvature of stomach into the duodenum, and because of this, there is thinning of the wall of the duodenum, and with there is necrosis and thinning of the wall, which causes perforation. This thinning or the necrosis of the wall can be considered in the form of ulcer, and this ulcer bleeds and can be seen in the form of hematemesis. It can be seen in the form of hematochezia. If it is present in the duodenal part, it will be seen in the form of hematochezia, that is black colored stools. And if it is in the stomach region, it can be seen in the form of hematemesis, that is blood in the vomitus. It is majorly seen because of duodenal artery, pancreatoduodenal artery, which is present just above the pancreas, which is the most common artery that is injured in a peptic ulcer.
Okay. Active management of third stage of labor.
Active management of third stage of labor. I'll have to read up on that. That zone I have to touch yet, sir.
Okay. And next, I want to know about pancreatitis.
Sure thing, sir. So pancreatitis is nothing but inflammation of pancreatic parenchyma. It can be acute pancreatitis or it can be chronic pancreatitis. The most common cause of pancreatitis in India is considered alcoholism. The second common cause is gallstones, that is stones in the gallbladder. So the major pathological point in this particular case is that there is autodigestion of the pancreas by the pancreatic enzymes, which are basically activated by the bile acids as well as the pancreatic acids, which cause the destruction of the pancreas. This pancreas can be in the form of necrotic pancreatitis. It can be in the form of pancreatic pseudocyst. It can be in the form of pancreatic pancreatic pseudocyst. It can be in the form of necrotic pancreas. It can be in the form of um, normal acute pancreatitis, and it basically presents as pain in abdomen, which is present in the epigastric region, along with elevation of serum amylase and lipase levels, which are above thousands of levels. The management protocol basically involves keeping the patient nil by mouth, reducing the secretions of the patient, reducing the pressure in the abdomen by putting a Riles tube and decompression of the stomach, as well as giving secretagogues, inhibition of secretagogues, which is given by Potide or octreotide, that is now available as somatostatin. Eventually, with time, the inflammation reduces, and the inflammation or the necrotic region of the pancreas is localized to one particular sac, that is known as a ward of pancreatic necrosis or ward of pancreas, that can be seen, and which can be later be operated or may not be operated, depending upon the severity of the condition. But however, every wise surgeon says do not touch the pancreas, so we would majorly try to avoid any operatives in such a patient.
Okay. My next question to you is, although you answered very well all the medical portion, wonderful. Even you answered stab, gunshot. Pudi orange, what is this? Have you heard about it?
So pure orange is basically the appearance of breast which is seen in carcinomatous patient. That is basically due to the lymphatic drainage of the breast or the skin of the breast is affected in such a patient.
Right.
And in such a patient, when there is a lymphatic obstruction of the skin of the breast, there is pulling of the skin behind, and whatever hair follicles are present on that on the skin basically become prominent because of that restriction, and which gives it a appearance of an orange, and hence the name is given as Pau de orange. That is the major symptom which can be seen and be confirmed that the breast lump which is present is carcinomatous, and is basically considered as stage 3 of breast cancer.
Okay. What is gastric outlet obstruction?
Sure thing, sir. So gastric outlet obstruction is basically a type of obstruction which is seen in the distal part of the duodenum or the jejunum or the stomach. Here, in particular patient, the patient has vomiting, which is more than passing of stools is less. Whenever we consider an obstruction as a complaint, we consider that the patient does not pass stools. But whenever there is gastric outlet obstruction symptom, the patient has more of vomiting rather than constipation. So in such a patient, the first thing is reduction in the reduction of the volume of the stomach. That is, decompression of the stomach has to be done. That is the first thing. Later on, the patient can be pushed up for an endoscopy for further investigation or for further testing, and the endoscopy can be advanced up to the duodenum or to the first part of jejunum in the form of enteroscopy. And if the obstruction can be relieved by cystoscopy, it is well and good. If not, open laparotomy is the option.
Okay. Tell some qualities like, according to you, armed medical corps must have.
Sure thing, sir. Sir, accordingly, what I think, which I have, I would consider myself into such a particular prestigious job role. I would consider ki I like a self-disciplined and a well-mannered life, which is in the box, which is suitable for the armed medical corps as a person. Secondarily, I am an adventurous person. I like to explore new areas and new cultures. So a person who is in armed medical corps has to roam all over India, and I would like to know the different places in the prestigious country that I live in. Also, I would like to travel all over India as well. Also, I am friends, and I like to make new friends, so I can get along in any region that I can be put. So I think that I at least possess the basic qualities which a medical corps officer should have, and I think I should be considered for the job role as well.
Wonderful.
Yes.
Nice intro.
Yes.
So we'll take one more mock session with you soon, whenever you want.
Sure thing, sir.
Okay. I want that.
Have I doubt?
Yes. Any doubt?
Yes, sir. I wanted to ask. I had some of my friends who are right now serving in the defenses. Right now, they are serving in RR hospital. So I asked one of them. They are basically MBBS people. But when I had